Good afternoon. After this small break, I'd like to give you an idea about what's happening about nutrition in the Sudan. And initially, I would like to thank FIGO for inviting me to be an ambassador for the Adolescent, Preconception and Maternal Nutrition, to the President of the FIGO and the Chief Executive. And especially thanks goes to the people at the FIGO office in London, Matt and Jessica, who made this possible for me to come over here. I thought to present it, to stick to what has been sent to us as template of the presentation. So, under 2 or 3 subheadings, in adolescence, then during pregnancy, and then the postpartum period. And just in adolescent period, data about the Sudan, the total population of the Sudan is about 31 millions. Out of those, 49% probably are female, and out of the 49%, which is 15 million, out of those 44% are in the age group of 17 to 39. And this is the target population which we are looking for in the initiative. We found that in a study in the Sudan, about 2 million children are stunted, are unlikely ever to reach their full growth and developmental potentials, which is really sad. Not only that, but the health services delivered in the Sudan, there is a lot of inequity about it, whereby urban areas are favored to rural areas. And it's sad, probably in most of the low and middle income countries, that's the situation. So during adolescence, not very much is being done to the girls. Vitamin A supplement is given for children under the age of 5. After that, little is being put into it. The children have the standard vaccination, but there is no nutritional policy for adolescent and preconception generally in the country. That led to, what has been done and what has been thought of. One of the things being done now is that nutrition is being taught at schools with the health education. And we got school health education reasonably good, and health services which are reasonably good, which involve the teaching of the nutrition. An initiative started to have folic acid as a supplement for the adolescent girls. That initiative actually was written, well prepared, and in the stage of implementing it, but unfortunately it failed. Another initiative for the adolescent is the preconception counseling. At the Federal Ministry of Health, that initiative was also studied, planned, but unfortunately not executed. Whether the reason is being financial, whether it being advocacy for the stakeholders, or whether it is the non-committal of the policymakers and stakeholders, is still to be found. I thought to give a picture which is slightly different to what's in the guidelines. What about the cultural and taboos about nutrition in the country? That goes for Sudan and probably for some other countries. We have early marriage, and that's especially in rural areas. In urban areas, that has changed. We got in the culture of the Sudan and probably other countries, the adults are favored in the provision of food. That's to say, males are favored over the females. The best of it goes to the man, and the rest goes to the woman. And if we take them, the group of a male plus the female and the child on one hand, the best of the food goes to the adult, rather than the children. That's still the situation in the rural areas. And as I said earlier on, the inequity of the social services and the medical services plays a role into it. We got certain beliefs in our country about the type of food to eat. And we know that some of the people there believe that if the hemoglobin is low, which is most cases due to iron and folic acid deficiency, if the woman goes and takes grapefruit or semi-cooked liver or raw liver, that helps greatly. And also we got another local fruit, we call it galdem, I don't know if it's in English, but that's the Arabic word for it, that is believed to help in the increase of the hemoglobin. The belief there is to avoid certain food during pregnancy and in childhood, especially eggs in children. The culture or the belief, it wasn't the truth, the belief is that they cause some deafness in the children. In the postnatal period, the food is mainly carbohydrates. And the idea is that at the end, the lady at the end of the 6 weeks should put on weight. That shows how good her postnatal period was. We have the change of the eating habits in urban areas now. Fast food is common. And in rural areas, vegetables and fruits are not really considered part of the diet. What they take is usually meat, milk, maize, and others. During pregnancy, there was a survey conducted in 2013 by the Federal Ministry of Health, the UNICEF, and UK Aid. The result of that survey, it was in 184 localities in all states of the country. Maternal malnutrition is high, up to 60% in some areas. Dietary diversity and taboos. I talked about the taboos and the cultures, and the female role. The female role actually in our country, especially in the rural areas, she not only have to carry the pregnancy, deliver the baby, rear the baby and look after it, but also to do hard work, whether that's in the farm or in the cattle or in others. So women are doing very hard work, actually, most of them, even those in the urban areas. Slightly too different what has been shown in the slide earlier on. During pregnancy, there is supplementation of iron and folic acid, and this is in most of the health centers. 42 of the 184 localities surveyed, the use of iodized salt is more than 50%. And now the government is planning to do more of the use of the iodized salt. The other supplements during pregnancy, whether that's calcium or vitamin B12 or whatever other supplement is provided in the private sector patients. Suggested actions. The antenatal care, what has been suggested by the Federal Ministry of Health now, the antenatal care is to be increased in the uptake and in the quality of it. That should be accompanied with increase in the midwives, and that's at the central state and at the center and at the state level. And increasing the maternal awareness about health and nutrition. What's the situation in the postpartum period? 73% of all births were delivered with the support of a skilled professional in the country. Exclusive breastfeeding is above 70%, in 89 of the localities. That's in the urban as well as the rural areas, but if you take the rural areas, it's almost 100% breastfeeding. The postnatal checkup. If the lady delivered in the rural area, usually the postnatal checkup is done by the midwife. she visits the lady during the 6 weeks, but if the delivery is within the government facility, few women do come for the postnatal checkup. During the postpartum period, vitamin A supplementation is given to mother, 1 dose for 6 months. But after that, the vitamin A is for the children under 5, up to the age of 5. Vitamin A supplement coverage is below 75%. Also, there is no definite policy for nutrition improvement. I thought to give you the situation as it stands now. That's to say, the period of the adolescent and preconception, there is very little care about the girl during that period, and also in the postpartum period. Some work, which is reasonably good, is done during the pregnancy and antenatal period. So still health promotion during the postpartum period, and by that I mean teaching of the ladies and teaching of the community. There is no food fortification in the country, so there is supplementation, but no fortification. The paradox is that the Sudan is very rich in agricultural products, but unfortunately, the understanding and the culture and the beliefs are not utilizing this richness in the product to the state of nutrition. I think I'd like to thank you very much for your attention.